Honorable Ministers, welcome back from lunch. I hope you enjoy your beautiful lunch today. Now we will resume our consideration of agenda item 9, panel discussion on primary health care. Please indicate your wish to speak by clicking the big button on your microphone if you are in the plenary, or by using the raise hand function on Zoom. Accordingly, may I call on the representatives from the country to be followed. May I call Philippine? Your floor is yours, Philippine.
Thank you, Mr. Chair. Good afternoon, everyone. The COVID-19 pandemic disrupted the progress of nations towards the achievement of health-related sustainable development goals. And this situation necessitates regenerating and reinforcing health systems through primary healthcare orientation. Primary healthcare that is equitable and accessible to every single citizen is at the heart of the Philippines' Universal Healthcare Act. It entails health reforms in national and subnational systems on health financing, health service delivery and regulation, and governance. Among the main goals of the UHC Act is to integrate local health systems into province and citywide health systems, which deliver quality population and individual-based health services. Now, to achieve these goals, new primary healthcare benefits have been developed and resources for health are being increasingly mobilized. The healthcare provider network is also being reinforced, and in its foundation are the primary care providers who shall facilitate and assist each citizen to access primary care services. The Philippines' primary care policy framework and sectoral strategies is an affirmation that a whole of government and society approach is indeed indispensable. It takes more than the health sector and political will to sustain primary health care as part of a comprehensive national health system and attain universal health coverage, and the support being extended by different sectors of government and society furthers the attainment of the objectives of UHC. The following are concrete interventions on the way forward to build health systems oriented towards primary health care. First, standardizing the competencies of primary care workers through competency assessment and certification assessments. Second, licensing primary care facilities. Third, registration of every citizen to a primary care provider. Fourth, constant updating and expansion of the National Health Insurance primary care benefit packages. And fifth, but not the least, collaboration with private sector and non-state actors to ensure complementation and augmentation of efforts. Lastly, Mr. Chair, strategies to address COVID-19 at sub-national levels were found to accelerate health promotion and epidemiology and surveillance. It has also pushed sub-national authorities to prioritize health more, thereby increasing its appropriations, and empowered individuals to be more responsible for their own health and appreciative of a continuum of care that promotes health and well-being during the life course. Thank you, Mr. Chair.
Thank you, Honorable Ministers from Philippines. Next on the list is China, to be followed by Malaysia. China, you have the floor.
好，谢谢主席，感谢秘书处的报告。中方注意
Thank
到
you, Chair. We thank the Secretariat for the report. China has noted the report addresses the many challenges facing the region in strengthening primary healthcare, especially in the context of COVID-19. To build a strong and resilient health system with a primary healthcare orientation, China would like to share some suggestions based on its practical experience. First, strengthen the PHC system to empower communities, build an integrated PHC system, develop service capacity standards, and carry out assessment to promote capacity building. Second, strengthen the HR development of PHC, train free medical students for remote areas through specific training projects, and improve the welfare benefits of primary healthcare workers and incentivize their efforts. Third, ensure equitable access to PHC. The government shall provide basic public health services free of charge to all urban and rural residents, with children, pregnant women, and elderly with chronic diseases as key groups. Fourthly, information technology plays an active role in the innovation of PHC. Primary healthcare institutions are encouraged to carry out online health education and guidance on chronic disease management, carry out health education, epidemic prevention, and control knowledge through Weibo, WeChat, and other new media, and pilot medical AI-assisted diagnosis systems in primary healthcare institutions. China is ready to continue cooperation with other countries in this field. Thank you.
Malaysia, to be followed by Republic of Korea. Malaysia, you have the floor.
Assalamu alaikum wa rahmatullahi wa barakatuh, and good afternoon, Mr. Chair. Malaysia commends WHO on its reiteration for member states to build strong and efficient healthcare systems geared towards primary healthcare. Malaysia has a robust health system that provides universal health coverage, access to quality, effective, and affordable healthcare services. The primary healthcare of the future, however, will not just contribute towards the preventive stage of the healthcare continuum, but also one that is predictive. As I mentioned yesterday, open data has been crucial in managing the COVID-19 pandemic. By rolling out our immunization program and contact tracing protocols through a digital application, MySejahtera, we have collected far more primary health data than ever before among the general population. More than 85% of our population use our ubiquitous app for checking into premises and showing their digital vaccine certificates and test records. They also have been answering basic questions on their health status, including whether they have comorbidities. We have used this data for deciding on who will be prioritized for vaccines by identifying people with comorbidities, and also for better monitoring of the health status of those who have to home quarantine due to a positive COVID test. In a classic example of unintended consequences and finding opportunity in crisis, we have now an almost population-wide enrollment into an enhanced digital primary healthcare program. With this data, we can apply analytics, predictive algorithms, and start offering prompts, nudges, and eventually schedule health screening appointments with family doctors and GPs. This will also augment Malaysia's move to increase the number of family doctor specialists at our clinics who will provide continued healthcare services to their clients. It is also an important component for our transition to lifelong digital medical records, which can be shared across the continuum of care. This will also complement our PECA B40 health screening program, which is free for lower and lower middle income households in Malaysia. Since we started this program in 2019, more than 530,000 people have gone through comprehensive health screening, which includes mental health screening and also breast examination for women and prostate examination for men. From this, 180,000 beneficiaries were classified as newly diagnosed NCD cases. So we will now be able to use this powerful digital innovation to not only screen, but for follow-up treatments and constant monitoring by putting the data in the hands of our people so they can take ownership of their own health. Of course, not everyone will have access to digital tools and devices. Malaysia will continue to enhance PHC for populations in remote areas through more conventional means. But even here, we have a vision to bring more digital health services and telemedicine by using satellite technology to complement our health workers' boots on the ground, so to speak. Thank you.
Thank you, Minister. Next on the list is Republic of Korea, to be followed by Laos PDR. You have the floor, Republic of Korea. Ma'am, we cannot hear you, please. We cannot hear you, Korea. Can we shift to Laos, PDR, and then we'll come back to you, Korea. Can we have the, yeah.
Honorable Chairs, Ministers, Delegates, in La People Democratic Republic, we identify strengthening of primary health care as a key pathway to achieve universal health coverage by 2025 and other health-related sustainable development goals by 2030. After the Global Conference on Primary Healthcare in 2018, we updated the PSC policies in our country by 2019 and relevant guidelines to reaffirm our strong commitment towards PSCs. Now we go through economic, demographic, epidemiological, and climate transitions. We believe that PSC is a core foundation to address current and future health needs of our populations in this transition period. Identifying strategic areas to improve efficiency in service delivery across program and primary healthcare levels will be critical in our preparation for donor transitions. Further, to ensure equitable access to quality of health services, especially for people in remote areas and vulnerable populations, strengthening primary healthcare will be a key priority, and we are strongly committed to leave no one behind through strengthening of PSC to reach the hard-to-reach populations. During the COVID-19, the importance of it has been highlighted more than ever to combat against the pandemics and sustain essential health services. We will continue to take a whole systems and a whole of society approach to strengthen seamless service delivery across continuum of care with improved quality of services, while placing people at the centers of service delivery at primary care levels. We look forward for more discussion of this important agenda and the futures, and we hope to get continued support from WHOs to move forward strengthening PSCs to achieve USC in our countries. I thank you, Mr. Chair.
Thank you, Minister. Next on the list is FSM, to be followed by Republic of Korea. FSM, you have the floor.
Do we control the screen? No.
Yes.
Thank you, and good afternoon, Mr. Chairman, distinguished delegates and ministers. FSM appreciates the report on revitalizing primary health care. In our view, a strengthened primary health care system is about health equity and how the government strives to deliver affordable and quality health services to its people. These services are not only people-centered, but integrated and focused on community health needs. Primary health care is the right thing to do, speaks about the value, universality, inclusivity of community health systems. The panel discussion on primary health care yesterday, where the honorable ministers from Tonga, New Zealand, and Singapore reminded us about the important three Ps: patients, providers, and payers. A health system that can clearly articulate the needs of its consumers, that would be the patients, and able to have cost-effective delivery system, providers, within a robust regulatory governance system, payers, will stand the test of time in meeting the health demand of its people. The locus and way this package of healthcare or primary healthcare is delivered will, of course, vary from place to place or economy to economy. During this COVID-19 pandemic period, we learned a few things about our own weakness in our own system. It shows that the healthcare side of our system is far from meeting what one would need to deliver good and integrated quality healthcare for individuals when and should they be diagnosed with COVID-19. On the public health aspects, we made some important strides. We realized we must adapt to new way of delivering integrated service of essential services in NCDs in our community health centers and dispensaries. I might add, FSM has started to vaccinate our adolescent population for COVID-19 within our schools. Through WHO support, thank you WHO and partners, FSM has been implementing a revitalized or strengthened primary healthcare program where community influencers, leaders are involved in the planning and coordination of services from day one. This approach brings key players and providers to provide outreach services. At the end, these communities have been able to reach essential services on a continued basis compared to before this project. This is an undertaking that FSM fosters among our key partners to address the burden of NCD and sustain essential services within our community. Thank you, Mr. Chairman.
Thank you, FSM. Can we hear interventions from the Republic of Korea? I see that there's still some technical issue with the...
Chair, can you hear me now?
Okay, yes, we can hear you.
Thank you. Thank you, Chair. As stated in the Declaration of Almaty, prior healthcare is the cornerstone for attaining sustainable health system and universal health coverage. The COVID-19 pandemic has reminded us once again the importance primary healthcare bears in our everyday lives. First of all, while experiencing the pandemic, Korea has honed in on the vital role public health center plays as a primary healthcare center. Even before the pandemic, public health centers in Korea have deployed disease prevention and health promotion plans to share the health of the local residents. Ever since the outbreak of pandemic, public health centers have played a key role in contacting, tracing, and COVID-19 patient management. In this regard, it is now time for us to adopt a comprehensive framework such as a community-oriented primary health care that oversees disease prevention, health promotion, disease control and care, and welfare of a regional community. Second, as chronic conditions have been putting increasing pressure to healthcare systems, community-based preventive healthcare services are growing in significance, but due to COVID-19, only a limited number of these services are available today. It is vital that we secure the continuity of essential health services even during a public health crisis. In addition, by using risk assessment, we need to decide which health promotion plan to maintain. And by providing a guideline, we need to devise ways to offer healthcare in a safe environment. If there are any best practices of other countries on this matter, we hope they could be shared through WIPRO. Third, we need to fully understand the significance of and limitation of digital health in the primary healthcare context. To make optimal use of digital technology, we need to identify which healthcare services are most effective when provided virtually to whom, and leaving multiple examples and practice to sustain the participation of the patient. In the case of Korea, health management services are provided to hypertension and diabetes patients through local primary healthcare center, and hospitals periodically check up on the health status of patients through phone calls, text message, and apps. For participating patients, a personalized health check voucher is provided to encourage continued engagement. Because contact-less services are gaining much attention as a result of the pandemic, there is a need to explore how we can most effectively use this method of engagement. Thank you.
Thank you, Korea. Are there any more representatives who wish to speak on this topic? I see there is none. At this time, I would like to give the opportunity to the non-state association for their interventions. Can I have the World Organizations of Family Doctors?
Hello, my name is Donald Lee, and I am president of the World Organization of Family Doctors. I welcome the opportunity to make a statement to this WHO Regional Committee. This statement refers directly to item 9 on the agenda, the panel discussion on primary health care. In developing and implementing comprehensive primary care, we urge Western Pacific region to adopt a policy of having professionally qualified primary care teams to deliver primary care. Family doctors trained in their specialty and leading the primary care team will lead to more successful outcomes and a more efficient use of limited resources. Investing in primary care professionals will reduce the financial burden on the health system by addressing the full range of primary care issues, and importantly, will care for people in their own communities. Primary care teams are trained and equipped to address challenges in context, the socioeconomic issues which impact on health, and they build knowledge of their communities and are trusted by them. The global pandemic highlighted the need for comprehensive primary care to be delivered as close to the patient's home as is feasible. But our health systems need to recover from COVID, and they need to address the huge swaths of unmet health needs which the pandemic hid, but which is now coming to light. Professionally trained and qualified primary care teams can address the vast majority of these issues, and for those patients who do require secondary intervention, most patients can return to their communities to continue their treatment under the care of the primary care team. Being serious about achieving universal health coverage requires the bold commitment to adopt a strategy of implementing professional, trained primary care teams to each of our health systems. We must deliver a better health future, addressing the continuum of care, addressing the needs of the population along their life course, and addressing the full range of health conditions and diseases.
Thank you, Dr. Wonga. Ministers, we will now suspend the discussion on this item to give way to the virtual excursions and rapporteur meetings. We will return, excuse me, we will return to this item on Friday morning with the wrap-up from the Secretariat. This concludes our meeting for today, and see you tomorrow. This meeting is adjourned.
Thank you very much, Honorable Vice Chair. So it is like a first trial of this hybrid meeting where we have the core time zone where we wanted everybody to come together. But in the same time, we wanted to have options of morning sessions and afternoon sessions that everybody can also join, but we wanted to give a little bit of a favorite time where the people live. So number one, we welcome everybody to attend both, but of course, the morning sessions we set up for the Pacific Island people, and then the afternoon session is for non-Pacific people. I very much encourage from tomorrow the sessions that if we can arrange that way. And I wanted to really appreciate some of our member states attended from the morning until end, but we welcome, but in the same time, we also encourage you to choose which sessions you're happy to join. So thank you very much, sir.